It's a pleasure for me to be here today. The title of our sermon is Be in Health. And I'm going to take a little bit of a different perspective today in my little talk that you would normally see from the average Seventh-day Adventist Reform Movement health seminar. But I think it's still very important, and hopefully it can be a blessing to all of us. And as we read in our key text, God wants us all to be in good health. And not only in good health, He wants us to also have things going well with our soul. So this is health, and Ellen White was far ahead of her time. Health is not something that is only physical abilities. Your body is healthy, you're free of cancer, but it's also something of the soul and the mind. And that's important for us. Now, as you know, I don't spend much of my life in good health. In fact, I have a quote that I once said. I said that I spend every day of my life in the worst day of someone else's life. And this is how I look in general, most of the time. This is me, how I look when I'm in a radiation area like the cath lab where people are getting stents or they're getting intravenous aortic valves. There's a lot of radiation, so I wear lead. And those are leaded glasses, thyroid shield, leaded garment, and that all avoids the radiation that's going around when patients are getting their treatments. And here's another example of my home away from home. So there you see the patients in the distance. On the left-hand side is my ventilator. I also have paddles where we can shock a patient if need be. And then on the right-hand side of that picture, you see all these little infusion pumps. There's 6 of them there, and that's common. I have those running. This is usually for like a heart surgery. And then you see on the far right-hand side in the close proximity there, you see my echo machine. That is where I run an echo, an ultrasound looking at the heart. How does the heart work? This is usually a setup in a heart surgery. How is that heart working? And somewhere in all this technology, in all of that, you see the patient's head, right over here. Here's another picture. Of my daily life. These things may seem scary, unique, new, hard to understand to you, but for me it's as natural as breathing. It can be so natural that it gets boring. You see here on the screen on the right, that's my ventilator. It's showing what pressure I'm giving to a patient, how many breaths I'm giving, how much tidal volume I'm giving a patient, even how much exhaled gases are coming out of the patient and what kind of exhaled gases. And then on the left-hand side, those are more infusion pumps. So truly every day of my life isn't a bad day for somebody else. I do a lot of lung surgeries, and a lot of those people, what are they having done? They have lung cancer. We're taking out a piece of their lung, or maybe a whole lobe of their lung. And they know that their prognosis is very bad. They know that, you know what, they might be dying soon. And they're doing everything they can to hang on to life. And it may not be around much longer, you know. So patients are not happy. It's a hard time. And I try to put myself in my patient's shoes every time I walk in on them. How do you present yourself? You want to give them comfort. You want them to be as relaxed in the mind as possible. You want them to understand what you're about to provide for them. You got to gain their trust in minutes. I don't have days, I don't have weeks, I don't have months to gain my patient's trust. I have minutes, and in the end, they trust me to do things that they would not let no one else do to them. Okay? I take them to the very precipice of death, and I bring them back, and many times they don't even remember my face, and that's fine. I remember them. I remember them all the time. So why am I giving a talk on prevention and health? Because I live in such a specialized world that the decisions of decades come for me to deal with now. It's the decision of decades. And I can't really talk to a patient 30 years ago. I can't really see somebody 30 years ago and say, hey, what you're doing in your life is bad. It's killing you. I only see them at the end. Many of my patients say, these are famous lines, I was completely healthy until this happened. Things were fine. I never went to the doctor. I didn't need anything, and here I am. Another one, oh yeah, I had a stent placed in my heart, so everything should be fine. The stents are there. I'm cured of my coronary artery disease. And they're doing that, they're telling me that because they need a hip or a surgery on their knee or something like that, and they think they've been cured because they got stents. Or I had my heart surgery, my 4-vessel heart bypass, and now I'm cured of my disease. They say I have a problem with my sugars, but I feel fine. It's not a big deal. I don't really have this illness. I don't feel like I have problems with diabetes. So these are decades of choices. Now these people have a second chance. Will they ever make a difference with the second chance they may get? Many of them won't. And I'll see them again later on. So this is the kind of life I live. The good news for all of us today is that Seventh-day Adventists, and especially Seventh-day Adventist reformers, we're different. We're different than the regular population. There's so much that we have, so much that we have been given. From hundreds of years ago, we've been given light that only now is becoming popular. Okay? Vegetarianism in the time of Ellen White, nobody wanted to hear about that. Veganism, we hear of raw foods, non-GMO. This is stuff that's becoming popular in our society today. But recently, very recently, you look back and, it was normal for everyone to be smoking. Doctors were smoking. Everyone was smoking. We thought it was healthy. Who spoke against that before them, before healthcare, before modern-day medicine? It was Ellen White. We have so much light. We believe in the healing hands of Christ, in water, exercise, sunlight, fresh air. We have hot and cold baths, all these natural remedies that much of the world is only now starting to get a handle on, and it's becoming popular. And we believe as Adventists, we believe that our temples our bodies are what? Our bodies are the temple of the Holy Spirit, which is in us. And if our body is the temple that houses the Holy Spirit, in order to be good servants of God, and in His plan, we need to keep ourselves healthy. Isn't that correct? But I believe with all this that we have as a church, we still might be lacking. And in everything in life, there's always something we can do that's better, right? We can always do something better. There's always a way we can improve how we manage our health. I'd like to ask the congregation, how many of you believe in maintaining your car? Getting the oil changed, new filter. Sister Maria maintains her car. Does anyone else maintain their car? Brother Alex, Tanya. So if you don't maintain your car, you could get a brand new Mercedes or Lexus, brand new. And you drive that thing off the lot and you just drive it. Maybe the only thing you do is put gas in it because you know a car needs to eat like you need to eat. But you just drive it and you never take it to the mechanic. What happens? You could have a $100,000, $200,000 car, the best of the best. What happens to the car? Never put another quart of oil in there, you just drive. Drive till the driving stops. That car does not live its intended duration to live. They can live, a good Mercedes, a good diesel. These cars can go for hundreds of thousands of miles, no problem, and well beyond 500,000 miles. They'll just keep going if you maintain them well. But if you don't have maintenance, here you have a picture of a pit stop. What race car driver would just want to drive? He doesn't want to invest the time at the pit stop to get the new tires for his car. Is he going to win that race? He's not going to win the race. You got to invest the time and the money in your car. Now, I'm going to tie that to our health. But before we do that, I think that many times we as reformers can find, and we see it everywhere, there's a conflict between Ellen White and modern day medicine. And my question for us is that real? Is that true? Is that something that we as reformers should be aware of? Is there really a conflict between modern day medicine and Ellen White? And I think it's safe to say there should always be moderation of something, but I think we many times go too far and misunderstand her original writings. I'm going to be quoting from this book. I really recommend it. It's by Dr. Mervyn Harding. It's entitled, A Physician Explains Ellen White's Counsels on Drugs and Natural Remedies. It's a very good book. He goes through all of her statements on medications, drugs, and he has a very fair and balanced look at what she is actually saying. And here are some quotes in this book, page 88, that he says. He says that Ellen White was compelled to oppose the harsh and heroic drugging so prevalent. And in 1864 she wrote that I was shown that more deaths have been caused by drug taking than from any other combined. And then she says, multitudes of physicians and multitudes of drugs have cursed the inhabitants of the earth and have carried thousands and tens of thousands to untimely graves. These are strong words. Thousands and tens of thousands to untimely graves. Almost 40 years later, she wrote, a practice that is laying the foundation of a vast amount of disease and even more serious evils is the free use of poisonous drugs. Powerful, powerful statements. Another quote from this book, page 88. 3 of these commonly used poisonous agents especially concerned her: mercury, calomel, and quinine have brought their amount of wretchedness, which the day of God alone will fully reveal. Perhaps preparations of mercury and calomel taken into the system ever retain their poisonous strength as long as there is a particle of it left in the system. These poisonous preparations have destroyed their millions and left sufferers upon the earth to linger out a miserable existence. And then at the very bottom you see of that quote, start of the next paragraph, I tell you this because I dare not withhold it. Powerful words. Is Ellen White opposed to medicine? So, a couple more quotes I got from this book by Dr. Harding. He says here that Ellen White's goal was to change the focus of the practice of medicine from routine use of powerful and harsh drugs to more physiologic remedies that were less harmful. She warned that these remedies, that even these remedies, that some of which she promoted, if they were used too often, may not be necessary at all. He even states that we should not consider her, being Ellen White, a drug nihilist, even though many often try to portray her as one. It's very interesting words. Mercury. Where do we find mercury these days? So, in poison water. Example, lead. That was another thing given commonly. Where do you find lead? You find it in Flint, Michigan when it's accidentally in the pipes, poisoning people. Okay? So, these things back 100, 200 years ago, they were thought to be medicines. People were poisoning, doctors were poisoning, it's like, oh, you have a headache? Oh, you have hip pain and back pain, we'll give you mercury. Oh, you have a fever, we'll give you mercury and a little bit of quinine. That's how they did medicine. They had no real understanding of the drugs they were given. When Ellen White talks of drugs of that time, they are what we know today as poisons. Many of these are as poisons. And every doctor on the block had his own snake oil mixed with this, that, and the other, and some mercury and 80% alcohol, and you drink this and all your maladies will go away. And these drugs were pushed on patients. And Ellen White was not lying. She was not joking around here when she said that millions, the lives of millions have been destroyed and have left sufferers on this earth to linger about a miserable existence. I'd like to propose to everybody that medications today have changed, okay? Sure, there are medications that are still unhealthy, but there is a time and a place for everything. There are medications for people with low thyroid that specifically give you thyroid hormone. For people with diabetes who have ruined their lives, it specifically gives you insulin or gives you ways with biochemistry that you can improve diseases that there are no other ways to treat. Diseases that they didn't even really have a good understanding of during the time of Ellen White. So medications that were just given unsparingly and with no understanding, we have greater understanding today. And it's hard to take Ellen White out of context from her time in the 1800s and twist her into the 2000s and say that Ellen White, if she were alive today, would condemn all use of all medication. That is a rough thing to say, and it violates the very principles of what she spoke. Here are very nice in the Drug, Herbs, and Natural Remedies. This physician found Ellen White's progression as to how she thought we should treat illness and disease among our people and among people in the world. He says here, first, change unhealthful habits causing the illness. In that time, no one spoke of that. No one spoke of cleaning up your diet. No one spoke of stopping smoking or stopping drinking. They just gave you the mercury. Take the mercury, you'll be better. Okay? It's becoming more popular now. Is it perfect? Do all physicians come to you and tell you, you know what, first you need to change your diet? First you need to change your habits? Not always. Not always, but I think it's getting better. See, there's ways healthcare can improve. 2, she said, regularly use harmless physiological agents and procedures. So you gradually go from lifestyle changes. If that's not working, then you start to look to the least harmful agents, the least harmful procedures that can make you better. And if that's not working and the illness is truly severe, then she talked about less harmful agents, but used judiciously and sparingly. So she slowly goes up the list of what you need to do to treat a person. And finally, in 4, if absolutely necessary, try the available strong remedies, but only rarely. Only rarely. That is how she approached healthcare. You know, people look, and this physician brings it up in this book, people say, you know, Ellen White, she was against all drugs, all things. Here she talks in this book about how she saw a vision of angels standing by the side of Dr. Kellogg while he performed surgery. And what happens in surgery? The surgery had anesthetics in there. Anesthetics are known poisons. Known poisons to humans, but yet she sees the angels supporting it. Supporting and standing by the side of Dr. Kellogg while he performs surgery. You know, a lot of the medications I give every day, they're poisons. These medications are used in capital punishment. The very medications I give to put somebody to sleep can be used to put someone to death. Yet I give them. It's very important we know the context of which medications are given, when and why. Because I'll tell you what, I'd much rather have surgery today than having 6 strong men holding me in a bottle of alcohol. Well, they cut out my bladder stone from down below. And that's how they used to do it. So times have changed. Times have changed. And we need to understand this as we read Ellen White and as we want to be judicious and smart consumers of healthcare as true reformers today. So maintenance. Do we need maintenance? Does the average vegetarian, vegan reformer need some sort of healthcare maintenance? So we can, I do believe, we can live up to the fullest light of our health message, but we can still be intelligent, judicious consumers of healthcare. We, every one of us, hold the keys to our health in our own hand. And this is a famous quote. Everyone knows that an ounce of prevention is worth a pound of cure, right? Benjamin Franklin. We still get sick. We still live in a sick world. We are degraded by thousands of years of sin, of genetic abnormalities, of poison in our water supply, radiation from the sun. There's nothing in this world that's healthy. You can eat just about anything, and I'll tell you there's something unhealthy about it. You can drink just about anything, and there's something unhealthy about it. Whether it's the plastic your bottle comes in, or it's the pan you cook on the stove, or it's you walking out in the sun to get vitamin D, but you're getting melanoma. We all get sick. We all get sick, and here are common areas. We know all this. Cardiovascular. Cancer, common. Oral problems. Are your teeth rotting? Are they falling out? Bone problems as you're getting older. Is your bone density the same, or are you in danger of having fractures? You know, we even have problems with the mind and spiritual problems. These are all tied together. And I propose to you that, you know what, it doesn't matter. In our church, we will have all of these. They may be a little bit less because we do the best we can with our health message, but you know, we live in a sinful world. We will have cancers in our church. We will have heart disease in our church. And it's important that our body, gets the normal maintenance. We'll go first into the heart. My goal here is not to give you a lecture. It's not to give you a list of things you need to do. My goal here is only to show that there are things that we need to be looking into as churchgoers, as people. Even non-churchgoers, we need basic preventative care. Ellen White says here in Testimonies for the Church, Volume 2, page 531, perfect health depends upon what? Perfect circulation. This is stuff she knew before anyone really understood what she was talking about. And it makes sense. Now the circulation, she makes it clear in her writings, and we know now that when I say cardiovascular, or the circulation of the blood, it's not just your heart. It means it's everything. It's the blood going down to your legs. It's the blood going up to your brain. Heart disease is tied to peripheral vascular disease, is tied to cerebral vascular disease. Notice vasculars and all of that. Because you can have strokes, and your heart risk factors can lead to stroke risk factors. In fact, the risk factors are exactly the same. And do we know these risk factors? Are we aware of these risk factors? The Health Reformer, May 1st, 1873. The more active the circulation, the more free from obstructions and impurities will be the blood. The blood nourishes the body. The health of the body depends on the healthful circulation of the blood. So true. So true and ignored even today. Until the blood circulation stops and you have a heart attack or a stroke. Then we worry about it, but we don't worry about it before that. So what are the risks that we have? And I put a little few things in here because we're good on some things. Diet, a modifiable risk factor. I think we're good. Most of us are clean on our diet. Many of us are vegan. None of us really eat any meat. That's very important. Smoking, I crossed it out because as a reformer, as an Adventist, I don't really see that being a problem in our church. These are big things in the world. These are big, big things. You smoke and your problem list just goes through the roof with cardiovascular, stroke, and cancer. But here are things, the secret risk factors, that if we're not looking, if we're not getting our maintenance checked, if we're not getting our oil checked and the new oil filter in our car, these are things that slowly creep on us as we age, and we may never realize we had a problem. Okay? High blood pressure. Elevated cholesterol, which normally your diet would take care of, but some people have genetic abnormalities. Okay? And they may have high cholesterol in general. Physical activity. Are we being active enough? Are we slowly gaining weight? Getting obese, and if we're getting obese slowly, we may not even realize the pounds creep on over the years. Suddenly you get insulin resistance, and suddenly it's not sudden, it's slow, but suddenly someone tells you might have diabetes. Would we even know we had diabetes? Have we been going to the doctor, and have we ever been told that, maybe you're pre-diabetic? Maybe you can stop this before you actually become diabetic? So I believe all of us are at risk of these risk factors. Many people in very young ages, they start to develop these problems. And even though we might be doing the diet and the other things, are we taking the preventative care into our hands to look for these things? Because these are ways we can improve. I'm going to list a few screening things. You don't have to take notes on this. If you just go to your doctor and say, I want a checkup, I think it's important. Okay? And I think another thing when we talk about being an educated, judicious healthcare consumer, it makes a difference in who you choose to be your doctor. Okay? We don't have very many in our church, but you can easily, when I was looking for my primary care doctor, and everyone needs one, You can look, does this doctor have more of a holistic approach? Or are they going to throw you on a drug right away and tell you nothing about your lifestyle? You can make that decision to pick somebody, a doctor, an NP, somebody in the primary field that, you know what, they are more aligned and they understand where you're coming from. They understand that first you want to try diet and exercise before you get on medications. These are important things. But if you never look, you'll never know. And if you just go to any doctor, you may not get the treatment that you would want to be treated. Okay? So high blood pressure. People need to get their blood pressure checked. You could get it checked yourself at Walgreens probably. But it's important that when you go to the doctor, there's other things you should be getting done. Like a lipid panel. Very young people can be getting elevated cholesterol, and they don't really realize that. So all it takes is a simple lab test. Just go to the doctor fasting. Make sure you're fasting. Have nothing to eat or drink before you go to the doctor for at least 12 hours. Okay? Your doctor may also tell you, hey, you know what? You're a great reformer, but you're slowly packing on the pounds. Am I an obese reformer? Sometimes you don't realize that, but it takes somebody to tell you, you know what? Because of our measuring tools, you're having higher risk, even though you may eat, vegan only, something's going on here where your weight is a little too much. And you know what? You might be at risk of getting diabetes. These are other things that if we do not look for, we will miss them. Okay? Diabetes, a direct result of obesity. And if we don't catch this early, you can easily miss this. So I want us to look at how do we view the law of God. The law of God is what? The character of God. And why do we need to look at the law of God? It shows us where we're deficient. Lab tests and screening tests are as the law of God. They are the standard. Much of healthy society fits into this. And you know what? When I get my lab tests and I get my screening done, it may tell me, you know what, John? You're deficient in the blood pressure. You're deficient in this. And you know what? Because I have looked and I have checked, then I can make a change. But if you, as a Christian, refuse to look at the law of God, then you think you're fine. Who needs Jesus and why did he die for me? We need to see where we are deficient from a standard. And that's why I encourage everybody to get their basic maintenance on their bodies. We talked about cardiovascular. There's other things. There's cancer. Here's a cancer cell that's dividing. Cancer is everywhere. In fact, a lot of us have cancer in us right now, and we don't know it, even us young people. It's there just growing, growing, growing silently. No one will ever know. No one will ever know. Tens, years, decades, and suddenly it becomes a problem. But it doesn't have to be that way. Ellen White, she was very, very wise, very far ahead of her years. Here she speaks, "From the light God has given me, the prevalence of cancers and tumors is largely due to gross living on dead flesh. I sincerely and prayerfully hope that as a physician you will not forever be blind on this subject, for blindness is mingled with a want of moral courage to deny your appetite to lift the cross, which means to take up the very duties that cut across the natural appetites and passions." Far ahead of her time. No physician agreed with her back then. Far ahead of her time, but we are starting to see that now. It is well known and well documented that this can be a problem. And we follow this well. But you know what? There are still things we can have. Genetic problems. Where we live. Maybe you have, a nuclear reactor explode nearby. There are things that can happen that we cannot control. And if we look, we can avoid problems. So how do we minimize cancer? This is what healthcare today has agreed. Avoid tobacco. Ellen White was ahead of her time. We know that. Now they agree with that. We need physical activity. We need a diet rich in fruits, vegetables, grains. Way ahead of her time. We're only now getting that. We need to avoid alcohol. We need to be careful with sun exposure. Here in Colorado, that's a big problem. Sun exposure. And of course, the more pure your life is sexually, the less cancers you're going to get. Well documented. We talked about what you need to avoid, but what is something that we can do each and every day to screen for cancer? Not each and every day, but once a year or when you go to the doctor. When you're a female, there's very little risk in getting a mammogram, especially when you're at the proper age, 40 to 50. Different societies say different things. You don't need to memorize when you need to get this. What you got to think is that, you know what? Maybe I need to go to the doctor, and maybe they just need to take some labs or do some basic screening exams on me. Because if you can get the cancer early, maybe they take out a lump, and you don't need a bunch of chemotherapy, and you don't need massive surgery. Females, they need basic cervical cancer screening as well. Now, a lifestyle can make this higher risk, but even people who have a good lifestyle, it is worth getting checked up on. What about colon cancer? Brothers and sisters, we have had people die of colon cancer in our church. And we do everything right. You'll have the fruits and the veggies and the grains and the fiber, and everything was done right. But if they would have just had a colonoscopy and somebody would have just seen that little polyp a decade ago, and they just go, boop, just take it away. They'd be here today. They'd be here today. They just snag it and it's gone. They did everything right. Except this. They could have caught it early. And now they're dead. That's how life goes. You know, just the little things. It may be uncomfortable. It may not be fun. But a little bit of investment now can go a long way a decade later. You know, melanoma in Colorado, I think it's important. We've had people in this church get melanoma. In this church. And because they get screening, they saw something or their wife saw something and they're like, maybe we should get it. And they got it scooped out and looked at. It's gone. When that is one of the most deadly diseases, and once that gets into your body, it's everywhere. It's everywhere. It's a death sentence. But just you know, you don't even need to go to a dermatologist. You just go to your primary care doctor and you say, hey, you know, I just want to make sure that all these moles look fine. And they may scoop one or two out just to look at them. I mean, very little discomfort for having malignant melanoma that's everywhere. Prostate cancer, there's all kinds of ways where you just take some labs or just have a basic screening exam that's very non-invasive. And if you have a holistic doctor that you agree with, you can be on the same page and go a long, long way on top of your great diet and health. Oral health. You know, this can be expensive. Going to the dentist twice a month can be twice a year can be expensive. But there are certain things that if we just invest some prevention now can go such a long way. Such a long way. You know, in heart surgery, I have a lot of patients. They have something called bacterial endocarditis. And that's the bacteria, they get into your bloodstream and then they grow. They grow on your heart. Here's a picture of endocarditis growing on a heart valve. And they'll grow in there and they'll just eat up that valve. They just eat it up until it's gone. And they need massive heart surgery. And a lot of this is caused, there's two causes, there's many causes. But one big one is poor dental health. Such a little thing. Such a little thing. Just maintenance. Just making sure your teeth are healthy. Doing the best you can. And if you're not careful, you can have big problems. Dental-wise or even systemically. Oral health is important. Now, I understand when I say this, you know, not everyone in our church has a full-time job that gives them dental and health benefits. But there still is Medicare, Medicaid, where if you look in the right places, you can still get health care for a fraction of the cost. And you can still get coverage in this nation. There is really no way you can't get coverage. You can still get coverage. So, even for those who may not have a full-time job, they can still get taken care of. There are many, many ways to help the underadvantaged. Bone health. You know, I don't want to go ad nauseum, but everyone knows the older you get, the more brittle your bones get, especially females. After they hit menopause, the bones get more brittle. There are things you can do. If you get a scan, if you see a doctor and they say, you know what, you're starting to look pretty frail, you know, maybe or even the Dexasan tells you before you get frail, you can get on some medications. Maybe all you need is vitamin D. Maybe there are just some things you can do to avoid having that devastating fracture, 5, 10 years later. This is all about avoidance. Doing the little things so you don't have to do the big things. And I could go on forever. I won't. Thyroid problems. Are you feeling down? Are you gaining weight? Maybe depressed? You never have energy? Maybe all you do is need a lab check that tells you your thyroid is low. And if you just get on that thyroid medication, which is a disease that has happened all through history and no one knew how to treat, but now we know how to treat it well. We know exactly what to give. And you can have a whole new life. You could be doing everything right, but you're hypothyroid. And if you just get on that one medication, your whole life is turned around. Maybe you're deficient in vitamins. Maybe you're deficient in vitamin D, B12, B. Maybe you have genetic abnormalities. My mom knows all about this. Just a little test. My goal here is not to make us, I'm not here to push drugs at all. But there are small things you can do, small things I can do to make sure that we prevent that pound of cure, because I just took that ounce of prevention. Now we're getting near the end here, and this is very important, and Ellen White spoke a lot about this, and only now, in the last decade or 20 years, has healthcare come around. There is an importance in the mind that I think sometimes is hard to understand even in our church. Okay? Now Ellen White says here that the sickness of the mind prevails everywhere, and what does she say? 9/10 of disease from which men suffer have their foundation here. Where is here? The mind. 9/10. 90%. When I grew up, my understanding of mental illness in church was almost that it was taboo. Depression, taboo. Anxiety problems, maybe even today. It may not be this church, but in many places around the world, post-traumatic stress disorder, psychological trauma, this is all taboo stuff. This is stuff that we don't talk about. But you know what? It's very important. And we live in a broken world, and we are here in the church hospital, but we all have our baggage, we all have our problems, we all have our strengths, and we all have our weaknesses. And you know what? Some people have psychological trauma, and they are among us. Are they getting the care they need? Are we encouraging them to get the care they need? Or is it, oh, you don't have depression, it's taboo. That is not the way to address this. I think our church can grow in many ways here. Many ways. We need young people to go into psychology, to go into biblical counseling, to go into, here I have marital problems and money management. This is all health. This gives you stress, and before you know it, you got high blood pressure and heart disease, and then you have your heart attack because you were, upside down in your home, in the red, everywhere, because you just had poor money management problems, and then you had marital problems, and your wife and you were fighting the whole time. And my goodness, in our church, you have to be married for life. Only if you die can you get out of this, and there you live your life of misery, sick, stressed, in debt, and full of marital problems, and you don't know how to get help. Because you know what, maybe it's something we don't talk very much about in this church. So I encourage people, young people, and if we do not have, our church is small, if we do not have it in various locations, people to help with this, there are psychologists, psychiatrists, marital counselors, biblical counselors, where you can go and get help and make your marriage better. Take care of your money problems. Take care of the stress and the trauma of the past. Maybe all it is an exercise program. Maybe all it is getting it off your chest and telling a psychologist, a Christian psychologist, this is what's bothering me, and then you'll be better. Maybe you might need a little bit of medication on top of that. But if you find the right person that has God's values in mind, I think it's a very safe and a very important thing to do. And a very important thing for our ministers and people in our church to be looking, how can we help the brothers and sisters in our church that have mental, spiritual, marital problems that wear us down. God didn't want us to get married to live a life of torture. marriage is for life and you just live a life of torture. We need help. We need to seek for help. It's okay for a reformer to say, you know what? My marriage is a problem. We need to go get help. Because what does Ellen White say? There can be hope here. There can be hope and there can be improvement. Everything in the mind can be tied to the body. It's all tied together. She spoke about it then, and we only now are starting to agree with that in the medical side of things. Mind-body, there is an intimate connection. We're almost done here. The relation which exists between the mind and body is very intimate. When one is affected, the other sympathizes. The condition of the mind affects the health of the physical system. If the mind is free and happy from a consciousness of right doing and a sense of satisfaction in causing happiness to others, it creates a cheerfulness that will react upon the what? The whole system, causing a freer circulation of the blood, a toning of the entire body. The blessing of God is a healing power, and those that are abundant in benefiting others will realize that wondrous blessing in both the heart and the life. If our religion, if our church does not give us peace in the mind, I don't know why we're doing it. And if our religion just gives us stress of all this stuff we need to do, that's not the purpose of it. God wants us to be what? To be whole, to be healed. To be healed not only physically, but spiritually. And if we got that wrong, I don't know why we're here. There's no purpose. There's no purpose. I see this all the time. And this is what I was, reference just to what I just spoke. Some health reformers are continually worrying in fear of their food. However simple and unhealthful, it will hurt them. Brother so-and-so brought eggs to potluck and now I'm going to die. Or, you're somewhere and there's nothing else to eat and now you have to eat an egg salad sandwich. And some people, this is a real stress. Their food is going to kill them. To these, let me say, do not think that your food is going to hurt you. But when you have eaten according to your best judgment and have asked the Lord to bless the food, believe that He has heard your prayer and be at rest. This is the religion He wants us to have. This is the peace that He wants us to have. That even though sometimes things may not be ideal, His peace that surpasses all understanding can still be a benefit, can still bring us up, can still heal us. Because when we're broken here, we're broken here. And when we're broken here, we're broken up here. It's all tied together. And only if Christ brings about a change in our mind, in our spirit, only then is all we're doing here really worth it. We're supposed to have heaven here on earth. We're not waiting for it later. That's coming. But there needs to be a true blessing that we all experience here on earth. So what happens? I'm sick. What should I do? I'm sick. There is a time and there is a place for a medical intervention. That's important. But I don't want us to forget that there's also an intervention that needs to be done spiritually. And here in James 5:14, it talks more about a terminal problem. And Brother Peter has actually he has 2 to 4 sermons on anointing the sick. There is a time for health care, but there is also a time for spiritual investment. And we need to go to our ministers for that. Is any among you sick? Meaning here, sick as in sick unto death. It's a terminal illness. You know what? This person is facing something that could end their life. Let him call for the elders of the church. Let them pray over him, anointing him with oil in the name of the Lord. Jeremiah 33:6. Behold, I will bring it health and healing. I will heal them and reveal to them the abundance of what? Peace and truth. Healing, but then peace. Peace of the soul. Peace as in safety. So in conclusion, brothers and sisters, my wish and prayer for all of us is that we may find what it is to be well as God wants us to be. Okay? that it may go well with us, that we may be in good health, both in our body and in our soul.